Hi everyone, Elise/Gordon here, and I'm here to talk to you today. This is video number 3 of my video series about my breast surgery, my breast cancer, and my surgery that followed. And this is going to be about my hospital stay. So I've arrived in my hospital room around 1:30 in the morning, and they're checking my new flaps every hour. Can't sleep. My mom is with me. She's probably delirious at this point because I've been under anesthesia since, whatever time, 10 a.m. She's been awake since, I think we got up at 5, maybe? She's been awake since 5 a.m. It's now 1:30 a.m. the following day. I think she took out a nap in there, but she was tired, believe me. But I was glad to have somebody there. And here's the biggest thing about having an advocate for you during your hospital stay is that the nurses were trying to push painkillers on me really, really hard. They're like, well, you were prescribed this. And Mom's like, well, can we start with Tylenol? One thing that they do put inside me is a medication called Exparel. And it's like these capsules that they put all over the surgical area that kind of keep you numb and out of pain for the first 72 to 96 hours after surgery, and then it just wears off. So it's pretty intense and it works great because I wasn't in that much pain. I mean, granted, I was cut open from edge to edge. Like, it's going to be painful. As my plastic surgeon told my family, people with surgery and expect to have no pain are delirious. It's surgery, you're getting cut, there's going to be pain. So they were pushing for the narcotics and the painkillers really hard. And my mom's saying, well, can we just start with Tylenol? So we did. And pretty much I did not take any narcotics or opioids the entire hospital stay or after. Because I'm pretty much a badass. Just saying. So we get to the room. They're checking me every hour. 4 hours later, I don't know if she's a medical student or a resident. She comes in and says, she's checking my drains and, checks, okay, have you had a bowel movement yet? And I looked at her like she had horns coming out of her head. Lady, I've been in here 4 hours. Nope, nothing's moving yet. I also haven't eaten since Monday night, and it's like Wednesday morning. So, no poop. And then she said, do you have a fever? And I looked at her and I'm like, I don't know. Do I? I don't know. Maybe you should ask someone who does the temperature thing because I don't freaking know. I'm in this bed here. I'm fresh out of surgery. I can't move. I don't freaking know. I don't know. And then, now keep in mind in my previous video, I said that I was injected with a radioactive dye so that way they could see my lymph nodes. This dye then gets processed through the body. It makes your urine blue. So she goes over to I'm still catheterized, and she goes over to my urine bag and says, it's blue. At this point, my mom is livid. We get it. We get that you're students. We get that you're learning, and we get that you have to ask a certain number of questions, but you may want to check, someone that's been in their hospital room for a few hours hasn't pooped yet. You may want to check with the nurse to see if there's a fever. The patient may not know. And you may want to check what kind of procedure they had, because then you can see if blue urine is normal for that day, which it was. So that was just a really funny situation. So Wednesday they checked me for hours, once an hour. I need to redo this video probably, but in any case. And then my right boob stopped participating with the program. The cool thing about these flaps is that they attach these tissue oximeters to them, so that way it can measure how much oxygen this new tissue is receiving. And they want it to be 50 or above, okay? If it goes down to 39, that's not good, and anything below 39 is critical. So what did I do? My right boob went to 39. So they're calling people in the middle of the night, waking people up. We got a resident coming in half asleep to check on me. And ultimately, they just decided, we're going to wait and see this out. What that meant is on Wednesday, nobody gave me any food because they weren't sure if I was going to go to surgery. So they keep coming. They're like, how you doing? I was like, I'm okay. And I'm hungry. I'm okay and I'm hungry. So That was the first part of my hospital stay in the beginning of the complications, to be continued.